Hello guys. Today we are going to discuss about a laboratory test called Chickenpox and Shingles test. Other name is Varicella Zoster virus, Herpes Zoster. Use of the test. You may need a test to look for the Varicella Zoster virus if your doctor suspect that you have or have recently had chickenpox or shingles and needed to confirm the diagnosis. You may be tested for antibodies to Varicella Zoster virus to check immunity to the Varicella Zoster virus after exposure to the virus or before receiving immunosuppressive drugs. Tests for chickenpox and Shigella are done to diagnose either a current or past infection with the virus that causes these conditions. Formal tests are often unnecessary when there is an active infection because a diagnosis can be made by the doctor just before examination. The clinical signs and symptoms, but a diagnostic test help to confirm the infection in patients with unusual or severe symptoms. In people who are at high risk from VZV infection, such as organ transplant recipients or pregnant women. Test for VZV antibody may be useful to determine whether a person is immune background. VZV, Varicella Zoster virus, is a member of the Herpes virus family. It is very common and the primary infection, called chickenpox, is highly contagious, passing from person to person directly from the blister or through exhaled air droplet and coughs. Varicella Zoster virus causes chickenpox in children and adults who have not been previously exposed. Usually, about 2 weeks after exposure to the virus, an itchy rash occurs, followed by pimple like spots that become small, fluid filled blisters. The blisters break, form a crust, and then heal. Typically, this process occurs in 2 or 3 waves or crops of several hundred blisters over a few days. Once the first infection has got better, the virus becomes hidden in secondary nerve cells near the spinal cord. The person develops antibodies during the infection that usually prevent them from getting chickenpox again if exposed to the virus. However, later in life and in those with immune system that are not working properly, virus zoster VZV can reactivate, moving down the nerve cells to the skin and causing shingles, also known as herpes zoster. Symptoms of shingles include a mild to intense burning or itching pain occurring in a band of skin. It is usually limited to one place on one side of the body, often on the trunk or the face, but can also occur in several places. Several days after the pain, itching, or tingling begins, a rash forms in the same place. The rash may or may not develop into blister. People with active shingles can spread varicella zoster virus infection to others who have never had the infection, causing chickenpox. In most people, the rash and pain of a shiggle reduces within a few weeks and the virus again becomes hidden. A few people may have pain that lingers for several months. Most cases of a chickenpox and shingles get better without complications. Occasionally, the broken blister can become infected with bacteria. Rarely, the virus can spread to the lungs or the brain to cause life-threatening infection. In people with compromised immune system or who are pregnant, varicella zoster virus infection can be more severe and long-lasting. The possible effect of Varicella zoster virus on a growing baby or a newborn depending on when exposure occur and on whether or not the mother has been previously infected. During the first 20 weeks of pregnancy, a primary Varicella zoster virus infection in the mother may or rarely cause congenital abnormalities in her growing baby. Babies infected in utero are also more likely to develop shingles in infancy. If the mother infection occurs 1 to 3 weeks before delivery, the baby may develop chickenpox just before or after birth. Although antibodies passed from the mother may start to give some protection, If a newborn is exposed to Varicella Zoster virus near to birth and doesn't have maternal antibody protection, then the VZV infection can be severe or even fatal. Sample a swab from the blister or the throat, blood, cerebrospinal fluid, or other body fluid. Tissue can be analyzed to detect DNA from the Varicella Zoster virus itself. Sometimes a blood sample is taken, normally from a vein in the arm, for Varicella Zoster virus antibody test. Normally it should be negative. That is about VZV.